According to data newly released by the Centers for Medicare and Medicaid Services, every single Medicare beneficiary in this country is about to absorb a financial hit that the government buried inside a routine fact sheet. And most retirees have no idea it's already been locked in. The numbers are official, the increases are permanent. And the question you need to answer right now is this: what percentage of your fixed monthly income will quietly disappear before your next Social Security check even clears the bank? Because what CMS just confirmed for 2026 is not a warning, it is not a proposal, it is already done. And if you are among the tens of millions of Americans depending on Medicare to keep your out-of-pocket healthcare costs manageable in retirement, the math inside this report is going to force you to make a choice you were never prepared to make. And if you think these numbers are just abstract policy updates, the growing panic among everyday Americans suggests otherwise. Take a look at what seniors across the country are saying right now. A user named Retired in Ohio 62 wrote, "I just did the math on my Part A deductible increase for next year and I nearly fell out of my chair. One hospitalization could now cost me over $1,700 out of pocket before Medicare pays a single dollar. I live on $1,900 a month. What exactly am I supposed to do?" One individual under the handle Fixed Income Fred shared, "They raised my Part B premium again, raised my Part A deductible, raised the coinsurance. Everything went up but my actual buying power. At some point, this stops being healthcare and starts being a bill I can't survive." A comment from user Margaret from Tucson reads, "I've been on Medicare for 6 years, and every single year I think we've hit the ceiling, and every year I'm wrong. I have a friend who spent 12 days in the hospital last year. The way these 2026 numbers are structured, she would have owed thousands before any coverage even started. These are not outliers. These are not people who failed to plan. These are Americans who did everything right, worked 40 years, paid into the system, retired expecting a functioning safety net, and are now confronting a system whose cost architecture is accelerating faster than their income ever will again. Now let us break down exactly what CMS released layer by layer, because the real damage is not in the headline number. The real damage is in how these costs compound against a fixed retirement budget in ways that the announcement never spells out clearly. At the macro level, what CMS confirmed on November 14th, 2025, is a structural ratcheting of every major cost-sharing threshold inside Medicare Part A for the coming year. This is not a one-time adjustment driven by an extraordinary event. This is the continuation of a multi-year trend in which the government's share of healthcare cost risk is being systematically transferred downward onto individual beneficiaries. People who, by definition, are in the phase of life where their income is frozen and their healthcare utilization is rising. Washington adjusted the formulas, Wall Street priced in the healthcare inflation, and the bill landed in your mailbox. The Medicare Part A inpatient hospital deductible, the amount you must pay entirely out of your own pocket before Medicare covers a single day of hospital care, has been set at $1,736 for 2026. That is an increase of $60 from the 2025 figure of $1,676. But here is where the systemic vulnerability becomes clear. That $1,736 applies per benefit period, not per year. If you are hospitalized, recover, and then return to the hospital more than 60 days later, that deductible resets entirely. You owe it again. For a senior managing a chronic condition, heart failure, COPD, diabetic complications, multiple hospitalizations in a calendar year are not a remote statistical possibility. They are the lived reality. And the government's own data confirms that Medicare beneficiaries average significantly more hospital contact than younger populations. The math on potential annual exposure is not $1,736. It is a multiple of $1,736, and that exposure is rising. But that is not the most alarming part, because the deductible is only the beginning of what you owe if a hospitalization extends past the first 60 days. For days 61 through 90 of a hospital stay, beneficiaries in 2026 will pay a coinsurance amount of $434 per day. That number was $419 per day in 2025. A $15 per day increase that sounds modest until you realize that a patient in this range is by definition seriously ill, likely unable to manage their own affairs, and burning through $434 of their own money for every single day they remain in a hospital bed. At that rate, a 30-day stay extending into this cost-sharing window would generate over $13,000 in personal liability, on top of the initial deductible already paid. For a retiree living on Social Security and modest savings, that is not an inconvenience. That is an irreversible retirement deficit event. That is the kind of single medical episode that permanently alters the financial trajectory of a household with no mechanism to recover. And for lifetime reserve days, the additional 60 hospital days Medicare provides as a last resort coverage buffer, the daily coinsurance in 2026 is $868 per day. In 2025, it was $838. That $30 per day increase may seem incremental, but when you are burning lifetime reserve days, you are by definition in the most catastrophic, most expensive, most medically severe hospitalization of your life. At $868 per day, a 2-week stay consuming those reserve days generates over $12,000 in additional personal liability. Lifetime reserve days, by their nature, can only be used once across your entire Medicare enrollment. They do not replenish. Once they are gone, and your daily exposure for extended hospitalizations becomes even more severe. Now translate this out of the language of policy documents and into the language of a real household budget. The average Social Security retirement benefit as of recent data sits at approximately $1,900 per month. Many beneficiaries receive considerably less. After Medicare Part B premiums are subtracted directly from that Social Security payment, after prescription drug plan costs, after supplemental coverage if they can afford it, many seniors are operating on a net monthly cash flow of $1,400 to $1,600. The Part A hospital deductible alone, $1,736, exceeds what most beneficiaries receive in a full month of Social Security income. It does not come with a payment plan. It does not accommodate your budget cycle. It is due. And for the millions of Medicare beneficiaries who do not carry a Medigap supplement policy, either because they cannot afford the premiums or because they were never adequately counseled on the options, that deductible represents a financial wall that can only be cleared by drawing down savings, liquidating assets, or going without. A hidden structural reality in this report is about to alter your benefits without your knowledge, and it involves the skilled nursing facility coinsurance. For beneficiaries who transition from a hospital stay to a skilled nursing facility, a scenario that is extraordinarily common among older Medicare beneficiaries recovering from surgery, stroke, or significant illness, the daily coinsurance for days 21 through 100 of extended care in 2026 will be $217 per day. In 2025, that figure was $209.50. That $7.50 per day increase compounds across an 80-day window of potential liability to represent a total potential exposure of over $17,000 for a skilled nursing stay that extends toward the benefit period maximum. The first 20 days are covered in full. Day 21 through day 100, you are paying $217 per day from your own pocket. And if your stay exceeds 100 days, Medicare's skilled nursing facility coverage ends entirely. Now consider what this means for a beneficiary recovering from a hip replacement, one of the most common procedures among Medicare enrollees, who requires 45 days of skilled nursing care. Under the 2026 structure, that individual will owe $217 per day for 25 of those days. That is $5,425 in out-of-pocket skilled nursing costs following a surgery that was itself subject to the $1,736 Part A deductible. The combined exposure from a single surgical episode could easily exceed $7,000 to $8,000. And that calculation does not yet touch Part B costs, physician fees, or any prescription costs during recovery. This is purchasing power evaporation in its most direct and personal form. This is not a macroeconomic abstraction. This is the moment a senior sits across from a hospital billing department and realizes that the retirement savings they spent 35 years building are about to be materially reduced by a healthcare cost structure that the government adjusts upward every single year, quietly, inside documents that most beneficiaries never read. The wealth erosion dynamic here operates on two simultaneous tracks. The first is the direct out-of-pocket liability described above. The second is the indirect erosion of the financial cushion beneficiaries need to absorb these costs. In an environment where inflation has already compressed purchasing power significantly over the past several years, the savings accounts that were supposed to serve as emergency medical reserves have already been drawn down to cover elevated grocery costs, utility bills, and everyday expenses that have not normalized. The financial buffer that was supposed to absorb a $1,736 deductible is smaller than it was, and the deductible is larger than it was. These two trends are moving in opposite directions simultaneously, and the gap between them is widening every year. Given this reality, there are several financial positioning strategies that retirement-focused households should be stress testing against these 2026 numbers. The first is a systematic review of Medigap supplemental coverage, specifically Plans G and N, which are currently available to post 2020 Medicare enrollees and provide substantial protection against Part A deductibles and extended hospitalization coinsurance. For beneficiaries currently without supplemental coverage, the annual premium cost of a Medigap policy must now be evaluated against the actual actuarial risk of the costs it offsets. In many cases, particularly for beneficiaries over 70 with any chronic conditions, the math strongly favors coverage. The second strategy involves the deliberate maintenance of a dedicated liquid healthcare reserve, separate from general retirement savings, sized to absorb at minimum 2 benefit period deductibles and 60 days of skilled nursing coinsurance. Based on 2026 figures, that reserve should be no less than $7,000 to $10,000, held in instruments that are immediately accessible without penalty. The third consideration is a formal review of Medicare Advantage plan structures versus traditional Medicare with supplemental coverage, with specific attention to out-of-pocket maximums, in-network hospital access, and skilled nursing facility coverage terms, because the plan that appeared cost-effective 3 years ago may now carry a structurally different risk profile against these elevated 2026 cost-sharing benchmarks. None of these are speculative investment strategies. These are defensive financial postures designed to prevent a single medical event from creating an irreversible retirement deficit that permanently restructures the household budget. Here is the question you need to sit with today. If you or your spouse required a 90-day hospital and skilled nursing stay beginning January 1st, 2026, do you have the liquid reserves to cover the full cost-sharing liability under your current Medicare coverage structure without touching your long-term savings, without selling assets, and without going into debt? If the answer is anything other than a clear and confident yes, then the data the Centers for Medicare and Medicaid Services just released is not background noise. It is a direct financial threat to the retirement you spent your entire working life building. Leave a comment below telling us how you are restructuring your healthcare budget for 2026, Dawan. Because the strategies seniors are using to navigate this environment matter, and this community is better equipped when we understand what is actually working. Stay disciplined, stay informed. The numbers do not negotiate.